Geraldo here for Advanced Urology Centers of New York. We make so many insignificant choices every day. Why not make an important one that really counts? When you're facing any urological condition, such as enlarged prostate, urinary tract infection, ED, or even cancer of the prostate, bladder, or kidney, you have a choice of where you can be treated. Why not choose the best? Advanced Urology Centers of New York is the largest urology group practice in our entire country, with over 45 locations. They're comprised of top board-certified physicians who are available from the routine to the most complex cases. Make the best choice for your own urological health. Call Advanced Urology Centers of New York at 855-DOCTOR-UROLOGY. The number is 855-378-7656. Or visit experturologycare.com.
From New York, for New York, live, local, on it. Geraldo, 77 WABC, where New York comes to talk.
This is Prostate Cancer Awareness Week, which is appropriate given the fact I just did that spot pushing the Advanced Urology Centers of New York. The president of the Advanced Urology Centers of New York, Deepak Kapoor, Dr. Deepak Kapoor, joins me right now. And I'm delighted to have him because I'll tell you why. My doctor, Harvey Walensky, has been my doctor since like 1970-something. And he said to me, I said, I'm 72 years old and I'm healthy. What am I going to die of and when? So he says to me, well, there's a 50% chance you're going to get a heart attack and die of a heart attack. I said, that's nice.
Right.
And he said the other 50%, 25% prostate cancer, 25% colon cancer, and he's just talking to me about the demographics and the odds. All right, so now, Dr. Kapoor, welcome, first of all. Thank you for being here. You got any good jokes on this? I understand you're really a good stand-up. Should I bend over right now? What should I do?
Well, you know what? If you have a glove and some lube, we could do it right here. But it would be a little bit better if it was television and not radio. So
I was going to say, if we're going to do that, we might as well put the cameras on.
I tell you what, why don't you just make the appropriate sounds and we'll just, there you go.
God, I think I'm falling in love. So what about it? I mean, is it like inevitable, these cancers? And I know, first of all, in terms of survival of prostate cancer, you know, my father-in-law, God bless him, Howard Levy, died of colon cancer, and he's one of the, everything went wrong. If it was 9 out of 10, this works, he was the 1 out of 10. And I don't know why, I don't know how he was treated. Some of the best places ultimately ended up here at, the big place on the east side. What's the most famous, not the cancer place? The most famous. What's those famous?
Sloan Kettering?
Sloan Kettering, yeah. Okay. He ended up there, but he died. And a wonderful guy. So what went wrong and what's going right now? Prostate cancer, what's the odds on surviving?
So at this point in time, Geraldo, first I want to thank you for having me out here on Prostate Cancer Awareness Month. It's really important to get the message out there to people how important taking control over your own health destiny is, particularly in the current era where we're seeing a lot more recommendations from government agencies trying to interfere and say, you should do this or you shouldn't do that. I think it's really important for men to understand that you need to take control over your own healthcare destiny and make sure that you're really adequately informed. So let's get a couple of basic facts, fun facts about prostate cancer, if you will. Prostate cancer is still the number one diagnosed solid tumor in men. Over 200,000 men a year are going to be diagnosed with prostate cancer.
So 200,000 a year?
Over 200,000. And despite all our advances, Geraldo, prostate cancer is still the second leading cause of cancer death. So we're still going to see a man dying almost every 32 minutes of prostate cancer in this country. Nearly 27,000 men are going to lose their lives. So while it's true that a small percentage, or I shouldn't say small, some percentage of men have indolent cancer that's slow growing, you have to be careful because not all prostate cancers are slow growing, and it can be a life-threatening disease.
All right, so what do you do about it? You know, how old are you? No?
I'm 47.
All right, so he's 47. What should he do?
Okay, so let's start from a little bit of history. In the past, starting from 1986, there was a blood test that was FDA approved that we started using for screening prostate cancer, and that really turned the tide for us. Now, one of the problems was back in the day, we didn't always have the technology because there are some prostate cancers that are slow growing, right? So there are going to be some men that are going to die with prostate cancer, but not of prostate
I get
cancer.
it.
They're going to die of something else first, like your father-in-law of colon cancer, or the 50% of men you just mentioned that are going to die of heart attacks, right? So what you have, we didn't always have the best technology to differentiate.
And now?
And now that's changed, particularly over the last 5 years, because we have much more sophisticated ways to interpret the screening test. We have molecular and genetic tests that we can utilize. And the reason why it's become a problem is in 2012, a government agency, the United States Preventive Services Task Force, I don't even want to say the name, I'm so mad at them, came out with a recommendation that no man should have PSA testing.
Why? Why? What's the point? Anyway, don't give me the why.
But
you say we should get the test.
And the reason we should particularly focus is since that recommendation, the number of men that have had screening has gone down, and we're seeing a shift toward higher grade cancer. So my strongest recommendation at this point in time that we follow in our practice that's based on international consensus guidelines, not by faceless government bureaucrats, but by internationally recognized experts on prostate cancer, is that every man should go ahead and get a screening done between age 40 and 50 as a baseline. And then from that baseline, according to your risk factors, like, for example, the two biggest risk factors for prostate cancer is a family history of prostate cancer as well as being of African-American descent. So you're 47. Anybody in your family have prostate cancer?
No. Gotta go. Advanced Urology Centers of New York. Listen to the spots right here on 77 W.